Hi, Dr. Hardy here, and this is my talk on spacers. So here is a spacer, and it's basically a cylindrical tube. It's plastic, and it is meant to use with an inhaler or your asthma pump. So the spacer has a hole on the side, and this is where you put your asthma pump. So if this is your pump, you stick it in the end of the spacer and you spray the medication inside. The other side of the spacer has the mouthpiece. And you basically hold this piece in your mouth, you insert your inhaler, and you spray the medication in the tube. When you use your inhaler with a spacer, most of the medication is suspended in the tube, and therefore when you slowly inhale the air that's filled with medication in the tube, more of it gets deep down into your lungs. So when you use a spacer, you get over 90% of the medication. When you don't use it and you just have your pump, it just sprays in the back of your throat. And therefore, you're getting way less of the medication. So as a pediatrician, I normally, when I worked in an outpatient setting, would prescribe their inhalers and also prescribe a spacer. You didn't get one without the other. Now I work in an inpatient setting and things are a little bit different. They often go home with the spacers that we had given them in the hospital, and we teach them as an inpatient how to use it, and they go home with it. So spacer, mouthpiece, the end where you put the inhaler in. They also have a spacer with a mask that you can put on the side for babies who wheeze or toddlers. Anybody who can't really coordinate a slow, deep breath. Because once you spray the medication in here, put it towards your mouth, you have to do it nice and slow and deep so it can get all the way in. So for the spacers with the face mask, basically there's a mask that you need to put a tight seal on the baby's face. Then you have the spacer at the end of the mask, and then the pump, and you spray the medicine. And they breathe in the medication, have them breathe in and out 3 to 5 times. You wait a full minute, put the mask on real tight again, do your second spray, breathe in and out 5 times, and there's your treatment. So most of the adolescents that I see don't use the spacer that I prescribed to them because they felt like, they had good technique now, they're not a baby anymore, they don't need to use a spacer, but in actuality, it has nothing to do with age. It's all about delivery. So if you want better delivery of medication, no matter what age you are, you should be using a spacer. It is also convenient because like with a nebulizer machine, you have to find an outlet. So if you're out and about, you may not necessarily have an outlet to plug in a machine and have all your, little respules, on you to give a treatment. But when you're using a spacer, this is so small, it can go in a purse and you can travel with it, and it's short, duration of therapy. So you don't have to sit there for 10 minutes getting a treatment like you do with a nebulizer. You basically, 2 to 3 minutes and you're done with the treatment. So highly recommended. Another thing I like to talk about is how to clean it, because when you use a spacer and spray the medication inside of it, you often start to see a white film of medication coat the inside of the spacer. So right now it is nice and clear, you can see through it, but as you begin using it, the medication sticks to the inner aspect of the tube. So you do lose a little bit of the medication initially. And what I was going to say is that you want to keep a little film of medicine on the inner aspect of the tube, and you shouldn't wipe it off and clean it every time. What that film does is prevents more medicine from sticking to the walls of the plastic, and eventually you have a higher concentration of medication within the tube. So you want to see a nice white film that ensures that what you're spraying in the tube has a high concentration of medicine, and you're getting even more delivery and a higher concentration of medication. So once that film gets a little too thick, then you should wash it. I know people who put it in the dishwasher, or you can take off the top, scrub it with a brush, clean it that way. But you shouldn't feel that because the spacer is white on the inside that it's dirty. Actually, it's not such a bad thing to have a white film in your spacer. So I really hope that this helps someone, and let me know your thoughts, and ask your doctor about a spacer if you actually use an inhaler, and if you use an inhaled steroid as well. You can use one if it's, in a pump form. You can use one with your inhaled steroids or your maintenance medicine that you take twice a day. Thank you.